Finding and understanding what the best Medicare plan is for you can be a headache. So today we're going to break down the basics of Medicare so that you'll have a clear understanding of what it is and how it works. So what is Medicare? Medicare is a federal health insurance program primarily for people 65 and older, but it also covers certain younger people with disabilities and those with end-stage renal disease. Now, Medicare has 4 main parts, each covering different aspects of healthcare needs. There's Medicare Part A, which mainly covers hospital stays, Part B for outpatient and medical services, Part C, also called Medicare Advantage, and Part D for prescription drugs. We'll dive into each part in separate videos so you can get the complete picture. At Health Plan Advocates, we're here to help you find the plan that's best suited for you. So watch our next video for a more detailed breakdown of the Medicare plans available for you. What is Medicare Part A? Think of Part A as your hospital insurance. It helps cover costs when you're admitted to a hospital or a skilled nursing facility. And what does Part A cover? Part A mainly covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health services. So, if you ever need to be hospitalized, Part A is designed to help you cover the big cost. How much does Part A cost? For most people, Part A is premium-free if you or your spouse worked and paid Medicare taxes for at least 10 years. However, there may still be deductibles and coinsurance. Out of all the Medicare plans, Part A is typically much more expensive and the cost varies year over year. Your income level will also determine the cost of your plan. Using Part A is easy. If you're enrolled, it'll kick in automatically for eligible hospital and inpatient services. But remember, it's always best to review the details to avoid any surprises. That's Medicare Part A in a nutshell. If you'd like to understand more about Medicare or other parts of coverage, feel free to reach out to us at Health Plan Advocates. And don't forget to watch our next video on Medicare Part B. In this video, we're going to explore Medicare Part B, the part of Medicare that covers medical services and outpatient care. Think of Part B as your coverage for doctor visits, preventative services, and outpatient care. It also covers things like lab tests, x-rays, mental health services, and even some medical equipment like walkers or wheelchairs. Unlike Part A, most people pay a monthly premium for Part B. The standard premium amount can vary year over year and is based on your income. There is also a yearly deductible, and after meeting it, Medicare typically covers 80% of the cost, with you responsible for the remaining 20%. The projected standard Medicare Part B premium for 2025 is $185 per month, up from $174.70 in 2024. However, the Centers for Medicare and Medicaid Services, CMS, has not finalized the 2025 premium as of mid-October 2024. Some other Medicare Part B cost changes for 2025 include income-related monthly adjustment amount, which is IRMA. The IRMA will increase for high-income enrollees. For example, a single individual with an income between $161,000 and $193,000 will pay an additional $279.50 per month. The Part B deductible is projected to increase to around $257 in 2025. The annual out-of-pocket drug spending will be capped at $2,000. If you don't enroll in Part B when you're first eligible, you might face a penalty if you choose to sign up later. That's why it's important to review your needs and sign up at the right time. That's Part B in a nutshell. Health Plan Advocates is here to help you decide if Part B is right for you. Up next, we'll be covering Medicare Part C. Today we're covering Medicare Part C, also known as Medicare Advantage. This part combines all of your Medicare benefits into one convenient plan. What is Medicare Advantage? Medicare Advantage plans are offered by private insurance companies approved by Medicare. These plans include all the coverage of Part A, B, and D combined. They often come with extra benefits like vision, dental, and even a gym membership. Medicare Advantage plans work through networks, so you may need to see doctors within the plan's network. They come in different types like HMO or PPO, which impact your flexibility in choosing providers. While many Medicare Advantage plans have low or even $0 premiums, you'll still need to pay your Part B premium. Out-of-pocket costs vary by plan, so it's important to review your options carefully. Typically, we recommend looking into the Medicare Advantage plan because it includes all the coverage of A, B, and D, which means it can give you the most bang for your buck. Want to see if a Medicare Advantage plan fits your needs? Health Plan Advocates is here to help. Stay tuned for our next video where we'll talk about Medicare Part D. Finally, let's talk about Medicare Part D, which covers prescription drugs. If you take medications regularly, Part D could be an essential part of your Medicare plan. Medicare Part D is optional prescription drug coverage available through private insurance companies. Plans cover a range of drugs, but each plan has its own list called a formulary, which details the medications it covers. However, starting in 2025, there will be a $2,000 cap on covered Part D drugs. When you sign up for Part D, you pay a monthly premium, which can vary by plan and location. There are also other costs like co-payments, and many plans have a yearly deductible. It is essential to review the plan's formulary and ensure your prescriptions are covered. In the past, you may have heard of a coverage gap, sometimes called the donut hole, where costs may increase temporarily. Starting in 2025, Medicare will eliminate the coverage gap, also known as the donut hole. Need help choosing the best plan for your needs? At Health Plan Advocates, we're here to guide you through the options and make sure you're covered. Typically, we recommend looking into the Medicare Advantage plan because it includes all the coverage of A, B, and D, which means it can give you the most bang for your buck. Thank you for watching our Medicare series.